Hi guys, Dr. Paul Hodgson here. I'm going to teach you today a little bit about mitochondria. So we're going to see who was paying attention during high school biology. I had a patient in the other day and I said, we're going to teach you about mitochondria, and he said, the powerhouse of the cell. And I was like, totally. So think about this as your cellular engine. This is your ability to take chemical energy and get it to do work, okay? So if the engine in your car isn't working, you're not getting to work on time. If the engine in your cell isn't working, you're not going to be alive. But if the engine in your car is kind of working, you might be able to get to work. If the engine in your cell is kind of working, you might be able to get through the day and get some things done. So this is really about, if we optimize the cell, you have enough energy to do everything that your body's trying to do, and that gives your body enough energy to give you to do everything in life that you want to do. So almost all the treatments that we do in this practice also take into account what's happening at the mitochondrial level. So patients come in for pain, injuries, ligaments, sprain strains, all kinds of disc issues, but we know that if we can fix this, they can fix themselves much faster, and it makes us look good. So let's just learn a quick thing. The size matters, okay? So, and a better mitochondria is actually a smaller mitochondria. So over time, what happens is these mitochondria get bigger, and that's problematic because they have to pass chemicals from one membrane to the other. So they have to get a chemical from here, glucose, over to here to become pyruvate. And if that's further away, it's harder to do the chemical reaction and it's less likely to happen. It happens slower. So, and then when it passes it over here, your body kicks off energy in the form of ATP. You don't need to remember all that stuff, but you just need to remember that if your mitochondria are bigger, they're not functioning as well. If they're smaller, that's better. So let's talk about two things that we teach patients in this office to help shrink your mitochondria, thus effectively making your mitochondria younger, healthier, and better functioning. The first one is red light therapy. Red, infrared, and near infrared frequencies all help shrink down mitochondria. The other side of that is blue light actually stretches out mitochondria and makes them grow. We happen to live in a blue light toxic world, meaning most people have too much blue light exposure and too little red light in their life. So most of my patients who have a problem, they're coming in with a symptom, a condition. Most of them have issues with their mitochondria, I would say, to varying degrees. So a very frequent treatment that we use is red light therapy. We have some special lasers with programmable frequencies. We have lasers with very specific frequencies to help the mitochondria do its work. The patients love them because they're warm and they feel good and they reduce pain, but I love them because I know that we're helping their mitochondria work better so that their mitochondria can work for them. The other thing that we teach patients on is temperature matters. So cold actually shrinks mitochondria down as well. So we start getting into intentional cold exposure, ice baths, cold showers. And the cool thing is if we can take a little bit of cold and a little bit of light, we actually magnify the results a ton. So if we can get a patient cold and get them to go out in the sunlight, holy cow, the results get really, really powerful. If we can get them cold and then use the laser therapy or the LED therapy, man, the results kind of magnify. So these are some of the different things that we're thinking about behind the scenes to help our patients get unique results.